Ghana is a country located in West Africa that was formed with the merger of the British colony of the Gold Coast and the Tagalog Trust Territory. It was the first colonial country in sub-Saharan Africa to gain independence, which happened in 1957. The country has seen many difficulties since independence was gained, including many coups. Religiously, the country is 71% Christian, 18.4% Protestant, and 13.1% Catholic. The country also holds many ethnic groups, including Akan, Mole Digbon, Uwe, Ga Dangme, Gurma, Guan, and Grusi. There are also many languages spoken within Ghana, including but not limited to Asante, Uwe, and Fante. Ghana faces many problems other than political coups. The health standards of the country are rather low. The people of Ghana face many problems, including malaria, lack of running water, especially in rural areas, and a lack of health education, particularly for women. Our company plans on helping reduce these problems by handing out mosquito nets, costing $300 million, providing water filters for people in rural areas, costing $300 million, and providing school supplies, contraceptive information to young women, and scholarships, costing $400 million.
Malaria poses one of the largest health risks to those living in Ghana, particularly children. It is a disease carried by mosquitoes infected by a specific parasite and results in chills, fever, flu-like symptoms, and death if left untreated. According to UNICEF, in Ghana roughly 20,000 children die from malaria each year, and it can be easily prevented through certain measures. There are many solutions to this epidemic, and our company has plans to resolve this widespread problem. Starting off, we want to spend $100 million to buy 20 million mosquito nets at $5 apiece in order to distribute to rural villages around Ghana. That requires transportation, so we will spend $15 million to ensure that even those living in small villages receive these necessary nets. Additionally, we plan to spend another $200 million on medication and supplies for treatment of those with malaria or for future use. Malaria is an entirely curable disease if precautions are taken and medical services are received in a reasonable amount of time.
Another issue we want to resolve in order to reduce poverty in Ghana is to provide clean drinking water to the people in rural areas. While most of the citizens of Ghana have access to clean water, in rural areas there are less people with access to this safe drinking water. One of the problems caused by unsafe water is diarrhea. According to water.org, diarrhea is very common in Ghana, and it is responsible for 25% of the deaths of children less than the age of 5. Diseases caused by poor water quality makes it harder for people to work and study in school. Also, communities and households in rural Ghana are spread out, making it hard and expensive to provide water treatment. We have decided that in order to resolve this issue, we will provide residents with water filters that are easy to use and do not require costly installation. We want to provide the residents of rural Ghana with AfriClay filters. This product uses pressed clay that forms the filter, and this clay is locally harvested in Tamale, Ghana. According to Pure Home Water, the filter alone takes out 90% of bacteria in the water. Next, the water is treated with colloidal silver, which is provided in tablet form, which then helps to remove 99.9% of bacteria in the water. The product itself is simple enough that the family should have no trouble using them, and they are designed to be very durable. Each AfriClay filter costs only $13, so we will be able to supply a large amount to rural Ghana without spending a lot of money. There are also inexpensive replacement parts for the product that will ensure its long lifespan. A total of $300 million United States dollars will be spent for improving water quality. $65 million of this would be spent on purchasing 5 million water filters, and $235 million would be spent on transportation, distribution, and teaching the families how to use these water filters.
Although education for females is the key to solve many of the health problems in Ghana, women's education rate still remains low. The literacy rate for male is 78.3%, while for women is only 65.3%. There is still a marked difference in the enrollment rates between females and males because of various reasons, one being the social expectations for women to be housewives and men to be the provider for the family. Therefore, women are not expected to achieve higher education. Although schools are officially free for everyone, schools still charge expensive registration fees, and on top of that, students must have purchased uniforms and necessary textbooks, pens, and supplies for schools. If they are missing any of the supplies or uniform, they will be sternly disciplined and sent home. 7 out of 10 females who graduate junior high school do not make it to high school because of financial problems. Early pregnancies can be one of the factors that prevent female teenagers from education. Due to the lack of sexual education and the use of contraceptives, 7.4% of the population is affected by HIV/AIDS in Ghana. In order to increase the enrollment rates of female students, we will provide school supplies, scholarships, and education on the use of contraceptives and HIV/AIDS. Providing school supplies to each student will be the cheapest and most efficient way to improve the enrollment rates. More scholarships should be provided to female students. Also, sexual education and the use of contraceptives would prevent HIV/AIDS and other sexual transmitted diseases, improving the standard of living. Studies have shown that when females earn money, they are more likely to put the money into savings, into community, education, or into families' well-being and health when compared to males. Educating women is the most effective way to improve the standard of living. For promoting education for female students, our company has $400 million budget. We plan on spending $200 million on the scholarships and the other $200 million on school supplies and information pamphlets about HIV and the use of contraceptives.
Ghana is a beautiful country, but its people are in need of help due to their health issues. Malaria, lack of clean water, and poor education for women has led to many health problems across the country.
The people of Ghana need you. Help us help them.